In this video, we are going to try to solve one or the doubts that are more asked before and after penile enlargement surgery. It's about if there's the possibility to damage the pump of the penis or if we can have several problems with erection. The first thing we should know is that while we perform a surgery of the penis, we are going to touch the skin, the penis itself, and the muscles. Once we have done the surgery, the nerves are not going to be touched. You have another video about sensibility where we focus on the part of sensibility and the nerves. But the thing with the penis getting erected, with the function, the sexual function of the penis, is that it belongs to the muscles. In the muscles, we are only going to put some stitches in order to make the muscles be between the pubis and the penis, because in this part it was supposed to be the ligament. We have divided the ligament, so there's an empty area. You have muscles at both sides of the inner part of the penis and at the lower part. These muscles are in charge of making the pump effect to get the penis erected, and we are going to put the stitches on them to try to make them be in the middle of the penis so they are stronger, and they are going to fill this empty area where goes the ligament. Once we have divided the ligament, we have the empty area, and if we don't put something inside, the penis can go back. We are not going to put only these muscles in the empty area, but we are going also to use some scarpa fascia, that is the fascia of the abdomen. We are going to remove a flap and we are going to put inside this part, okay? But the real thing is that the pump effect, the penis getting erected, is not going to be affected. There's one thing that is true and you should know from the very beginning, that is that during the first 6 months, the penis is bigger, is thicker, and at the end, your muscles are not used to this size. Your vessels have not the diameter that they need for giving enough blood to your penis. So it's very useful that during your first relations, you feel that your penis is not that erected. But it's something that is in your mind first, absolutely. And the second thing is that the more you do sex, the more you touch yourself, is better for your penis, because you are going to make your vessels get bigger, increase the diameter, so allow more blood to arrive to the penis, so the erection is going to be better. Okay? If you have problems with erection, it's not directly related with penile enlargement surgery, but we can do several things to try to increase how the penis works, and we use the stem cells, the same that for increasing the thickness, but it's not the same procedure. I mean, when we have the fat, we make some kind of centrifugation if we want to put it inside the fascia for increasing the thickness, and if we want to achieve a better result in erecting sense, I mean, if we want to have a penis that works better, we are going to use different kind of stem cells, so the procedure is different. You can ask us, because many times we do both surgeries at the same time. According to this video that was about how it's going to work the penis after the surgery, the thing is that it has to work perfect, the same as before surgery or even better. The other thing where you have to focus your mind absolutely is trying to be relaxed after the surgery. You want to see the results, you want to enjoy them. So instead of getting excited with your mate or with the people where you are practicing sex, you are focusing all your attention in your penis. And it's the same as when you have troubles, and instead of being where you are thinking about your problems. The penis doesn't work. So, after surgery, it's more important even not to try to measure how long it is, how is the width. If we arrive to 10 centimeters or 15, this, I understand that it's very difficult, that this has not to be your goal after surgery. You have to enjoy your penis the first 6 months. After that, you can check how much we have gained in the thickness, in the length, and whatever. But the first few months, you have to forget your penis and just enjoy the results.